Endometriosis causes tissue that is similar to the lining of the uterus to grow in other places where it doesn't belong.
Is irregular period a symptom of endometriosis? Yes, irregular periods are a common symptom.
Endometriosis can cause pelvic pain, heavy periods, and fertility issues. Treatment involves medication, surgery, or a combination. Endometriosis is a condition where tissue that is similar to the lining of your uterus grows on other parts of your body. When this tissue grows in the wrong places, it can cause painful symptoms that can impact not only your menstrual cycle but also your daily life. Endometriosis can cause scarring and block the fallopian tubes, leading to trouble getting pregnant.
Some of the most common places you can develop endometriosis include the space behind your uterus, the myometrium, ovaries, peritoneum, and fallopian tubes.
Rectum, bladder, intestines, diaphragm, vagina, lung. Endometriosis affects about 1 in 10 females worldwide, most often diagnosed in people in their 20s and 30s. The symptoms of endometriosis are often manageable with treatment.
With the right treatment, relief is possible.
Symptoms of endometriosis. There are many symptoms, but the most common is pelvic pain. This pain can be intense or mild. Symptoms often feel worse just before and during your period due to inflammation.
Symptoms of endometriosis include very painful menstrual cramps and abdominal or back pain during or between periods.
Heavy bleeding during periods or spotting between periods. Pain during sex. Infertility.
Endometriosis can cause pain when pooping or peeing, and stomach problems like diarrhea or bloating. Some of the symptoms only found when you can't get pregnant. There's no connection between your symptoms and the severity of the condition. Some people may have very few patches of endometriosis and still experience severe pain.
Other people might have many patches of endometriosis, but not experience any pain. Endometriosis doesn't cause weight gain.
But I feel like I am.
That's the bloating and fluid retention.
What causes endometriosis? Healthcare providers don't know for sure. With endometriosis, tissue similar to the uterine lining grows in the wrong places.
Researchers are looking for a connection between endometriosis and other conditions,
Like retrograde menstruation, immune system issues, and hormone disorders.
retrograde menstruation is when your period flows upward through your fallopian tubes and into conditions like endometriosis.
Who can get endometriosis? It's a condition most common in females aged 20 to 40. It can also happen to younger people during their teenage years. Although many find
relief from endometriosis after menopause, but it can still cause discomfort and pain. It's important to be aware.
a biological family history of endometriosis can place you at a higher risk of developing the condition. Risk factors include short menstrual cycles, long and heavy periods, and never having children. What complications can endometriosis cause? There are several complications that can happen if you have endometriosis.
Endometriosis can cause complications, including pain that disrupts your well-being and daily life.
People with endometriosis may also experience fertility issues. Other than chronic pain and infertility, severe endometriosis can lead to complications like bowel or bladder problems, shortness of breath or chest pain. Rarely, endometriosis can impact your lungs or diaphragm. This can cause breathing difficulties. Endometriosis causes tissue to grow in the wrong places. This can block the fallopian tube, so the sperm and egg can't meet.
Painful periods made me see a doctor.
We'll review your history and symptoms.
What tests will I need?
An ultrasound can help.
Medical and family history. Then, we'll do a pelvic exam and possibly an ultrasound or MRI.
Several tests can suggest endometriosis, like the only way to...
Laparoscopy helps with diagnosis and treatment. Sometimes the location of endometriotic lesions may make it hard to remove without damaging the underlying critical structures. This operation may require a team of surgeons, such as minimally invasive gynecologists, colorectal surgeons, or urologists.
The only definitive way to diagnose endometriosis, a small camera is used to find the tissue, and a biopsy is taken for testing.
Sometimes endometriosis is found by accident. Not everyone with endometriosis has symptoms. It might be discovered during another procedure. If you stop, symptoms can return. Not for use during pregnancy. Discuss with your provider. Danazol stops the hormones that cause your period. While taking it, you may have occasional periods, or they might stop. Endometriosis after menopause is not typical. It may reactivate due to hormone replacement therapy. Talk to your doctor. Hormonal options for endometriosis include birth control. They come as pills, patches, shots, implants, or IUDs.
Yes, you can get pregnant with endometriosis. It may be more challenging. Talk to your healthcare provider. What is the treatment for endometriosis? Your doctor will create a plan based on severity, future pregnancy plans, your age, and pain levels.
Over time, the tissue can cause cysts, adhesions, and scar tissue, leading to severe pain and fertility issues. Medications can help manage endometriosis symptoms. NSAIDs like ibuprofen. Hormonal therapy can also help with pain and cycle suppression.
Will remove or destroy any suspicious tissue. This inflamed patch will be excised, and this spot will be destroyed. This medication stops the hormones that cause your menstrual cycle, putting your reproductive system on hold to relieve pain. Can endometriosis go away on its own? In some cases, yes. This is more common after menopause due to lower estrogen levels.